So Act 8 of 2020, which I authored, allows managed care organizations to have access to the prescription drug monitoring program to help the state better address the opioid and heroin epidemic. And as part of that legislation, counties and municipalities also have access to some of the information contained in the PDMP for educational and research purposes. The legislative intent of the bill was not to include any personally identifiable information in the information that the MCOs or the municipalities can access from the PDMP. The intent was only to see information in the aggregate and not have access to individual information, and certainly not personally identifiable information. And I just want to make sure from you that as the act is being implemented, that the legislative intent of the bill is honored and that there will not be any personally identifiable information shared through access from the PDMP.
Just to clear, so there's two different data sets that are available in the PDMT. There are patient data and then provider data. Was legislative intent both patient and provider, or is the real focus on a patient?
The focus of the legislation was really to give municipal entities and the MCOs data that would enable them to do better education and better outreach, and not that down deep in the weed, personally identifiable data.
I guess what we're trying, so they will have access to provider data. So they would have access, for instance, to Dr. Smith and his or her prescription data. And I think that was, our understanding is that was part of the intent, so that insurance companies, if they see an overutilizer, can work with that overutilizer in terms of their opioid stewardship, and the same in terms of county and municipal health departments, meaning that person is overprescribing.
I think that we should probably have an offline conversation going forward.
Yeah.
Okay.
Yes, yes. Thank you. Thank you very much. Also wanted to talk to you about Act 112 of 2019, which requires the completion of opioid treatment agreements by physicians and other providers who prescribe opioids for a chronic condition. Many physicians are already doing this, but Act 112 brings uniformity to the practice. And your department was required to publish temporary regulations within 90 days. And the law was enacted on November 27th of 2019. And 90 days takes us to yesterday. So we've done a search on the Department of Health's website, but have not been able to find any publication as of this afternoon. And those regulations are essential because physicians and other providers could face penalties up to suspension or revocation of their licenses to practice if the mandates of Act 112 are not followed. So has your department issued temporary regulations on Act 112?
We have drafted those and submitted them to the PA Bulletin to be published, and looking at our team, they're planning to be published on March 7th.
On March 7th, okay. Can we assure our providers that they will not face consequences until those regulations are made public to them?
Yes.
Yes.
Yes, okay. Thank you, because I spoke to a group of physicians in York back in December and received multiple questions from them because they were confused about what Act 112 would require from them. They weren't sure as to whether it was acute or chronic pain. And provider membership organizations are doing their best to provide that information to their members, but again, needed that assurance and would like to have some specificity from the department to advise their memberships more effectively.
In addition to the temporary regs, we're also working on some fact sheets and information that would be both available for providers, but also for the patients. Either they could get directly from us at the Department of Health, or the providers could use those documents with their patients.
And those will be available on March 7th as well?
Those will be on our website, either on March 7th or before.